All right, let's do a quick chat about chest trauma. So most trauma is broken down into blunt or penetrating trauma. So if we have blunt chest trauma, what do you think is like the #1 injury that we see? Well, you've got it. So that's rib fractures, okay? So rib fractures are a big problem because what happens is the patient develops a lot of chest wall pain. They can't take in a deep breath. They can't have a meaningful or strong cough to get rid of any of that sputum that gets down into the lower airways. And then they can develop pneumonia, respiratory failure, and become ventilatory dependent. It's a big problem. So one of the most common things we deal with in a trauma center are rib fractures. Number two, we'll kind of put these two together, would be a pneumothorax or a hemothorax. So you guessed it, the rib fractures can cause the pneumothorax or the hemothorax, or blood in the chest cavity. So when the ribs become fractured, they can damage the lung tissue. When the lung tissue becomes damaged, air escapes into the chest cavity, and that can create a pneumothorax, which is a collapsed lung. Or it could injure the lung itself and cause a hemothorax. There's also blood vessels called the intercostal artery and vein that run under each rib that can also lead to bleeding. So what other structures are within the chest? Well, there is your trachea in your neck and then the two main bronchi. Injuring those is pretty rare. Now, a neck injury is separate from chest trauma for the trachea, but the actual bronchioles, the right and left mainstem bronchi of the lungs, are a pretty significant injury to cause damage to that. Then inside of the chest as well, we have the mediastinum, for which the esophagus is there. Also extremely rare to get an esophageal injury in the chest, but if this does happen, it is a major, major problem. And then, of course, as we all know, we have our heart within the chest. Again, in blunt chest trauma, you could get a blunt cardiac injury for which we check troponins, just like we would check for a heart attack. And then we also always get an echocardiogram. And then lastly, a penetrating injury to the chest can really injure the heart.